Hey guys, today is Sunday. It is Celiac Awareness Month, day 5. So thank you guys for tuning in. My apologies for, let's see, for forgetting to turn that off. All right, we're going to have some fun with technical stuff. I have no idea if this is recording or not. There's still something weird going on with my Facebook. So I think I'm just going to go ahead and do this, and then we're going to find out afterwards whether or not this recorded. That means I can't see any of your comments as they happen to come through. So thank you guys for tuning in. I have got to figure this thing out. Okay, so today's topic is allergies versus autoimmune. And this is rather important because when it comes to celiac, people get a little bit confused. You know, they'll say, okay, celiac is an autoimmune response, but their thought is, well, there's other autoimmune responses and they aren't all that risky, is kind of the perception out there. Where they'll think about the fact that they said, well, celiac is an intolerance to gluten. And so it can get lumped into that category of like a lactose intolerance. This is completely different, okay? Lactose intolerance, you're going to have a short response to something that is going to be uncomfortable, that bloated feeling. It could extend for a few hours, but eventually it's going to go away. Celiac is completely different. So let's talk about what an allergy is first, and then we'll get into what an autoimmune response is. So an allergy has to do with, particularly I'm going to talk about a food allergy. So when a person has a food allergy, they ingest food, and then their body will have a certain type of response. And I actually was pulling this up. I looked at a couple different sources, and so I like to have a little bit of kind of notes, but well, pull them from my phone. So anyway, an allergy specifically like to wheat, what happens is when the person ingests wheat, that their body will have a response. The type of white blood cells called B cells will send out immunoglobulin E, otherwise known as IgE, antibodies to attack the wheat. And at the same time, local tissues in the body send out natural chemical messengers to alert the rest of the body that there is a problem. So this happens very fast, usually within minutes, and can involve a range of symptoms from nausea, abdominal pain, itching, swelling of the lips and tongue, to trouble breathing or anaphylaxis, which is a life-threatening reaction. Now, I think we've seen this, you know, whether you've seen it in person or seen it play out in the movies. I think that sometimes in the movies, this might be one of those things where they kind of get it a little bit right, depending on what you've seen. But it can be, you know, something that starts out as something like an itchy throat. And the thing with a food allergy is that the more that they're exposed to that allergen, their reaction can get worse and worse. So I know when I was talking to another mom whose child is allergic to a couple of different types of nuts, she talked about how her child, you know, early on didn't have bad reactions to it, but had noticed that it could become worse. And so this child has to have EpiPens at school because it can be life-threatening to that child, having an immediate response with how the body reacts to it. The one thing about looking at or putting celiac in the same category, although it shouldn't be, as an allergen is that because of the fact that people understand when it comes to that body's response to an allergen, they are more likely to take the proper protocol and precautions when it comes to cross-contamination. However, for some reason, even though they might try to put it in the category as an allergen, when it comes to talking about celiac, people don't get that the same protocol has to be taken as far as avoiding cross-contamination. The washing of the different utensils, the using a clean surface, using utensils and surfaces that are not porous, so like the plastic, whereas something can leach into the plastic containers, especially if they've been heated up, then you're not going to use those same plastic containers for something that doesn't have nuts, or for for a person with an allergy. Same thing when it comes to gluten. So if somebody's recently diagnosed with celiac, what happens is they do have to go through, and we'll talk about this a little bit later, but they'll have to go through the kitchen. And actually there are certain things that absolutely have to be replaced. And it has to do with the fact that you don't want to trigger that autoimmune response. Now we did talk about that in a food allergy response that was happening is that the person, has the reaction, and it can be anything from itching, scratchy throat, all the way up to the full-on anaphylaxis reaction, you know, with having trouble breathing. And a person can, in fact, die shortly after after ingesting the food that they are allergic to, depending on what that food is and how severe their allergy is. With an autoimmune, sorry, I need to grab some water here. With an autoimmune, it's different. The body can react immediately, or it can have a delayed reaction. And some of the reactions, actually, when it comes to celiac, can look similar to a food allergy. So can have the abdominal pain. It can have the digestive reaction. So those could look similar, or the person could possibly not necessarily feel it or have a specific feeling type of reaction, but that doesn't mean that the damage isn't still occurring. So we talked about the IgE when it comes to food allergy. In celiac disease, though, as I look at this, because I was trying to go back and forth between a couple of different areas, but what they're looking for is a different type of immunoglobulin reaction. And so allergies, sorry, I've got to go back to this. Allergies are diagnosed through an allergist or a primary care physician if they happen to have the allergy testing, as I know that some primary care physicians are starting to do that. Celiac can technically be initially diagnosed either in a primary care or a gastroenterologist office. For celiac diagnosis, though, the person does have to have gluten in their system in order to, on the blood test, show the immunoglobulin responses. So that's looking at, there's such controversy over this, but it is a blood test versus a scratch test. So there's IgG and IgA are the two that are most commonly known for what they're testing for. In order to have that autoimmune response, here's where it gets even more fun. A food allergy is an immune response, but it is not an autoimmune response. Isn't that even more fun? So what happens, though, when a person ingests gluten, though, is that they will have a reaction. Like I said, sometimes they'll feel it, sometimes they don't. But eventually what's happening is it's getting to their their villi and blunting them, which happens to affect the person's absorption of nutrients in their food. So they're becoming malnourished, and they can have all sorts of different reactions to it. The other thing is when you have one autoimmune response or one autoimmune disorder, unfortunately what that does is it also puts you at risk for having other autoimmune disorders. And the age of onset actually is what will increase that. So the later that you're diagnosed with celiac, what I've seen in the research is that the later that a person is diagnosed with celiac, the more likely they are to have other autoimmune responses or other autoimmune disorders. So when you think about that, usually if they're diagnosed later, it's also because they have been going through their life or a certain amount of time with experiencing this. Now, here's the interesting thing. There is usually a traumatic type of event or an autoimmune response system, basically where the body's immune system is weakened, that tends to lead to the diagnosis of celiac. So there have been, as I looked through different websites, Facebook groups, and hearing about people's stories about how they were diagnosed, a lot of the time there's something that definitely puts the person at risk for having their immune system weakened. It could be something like having a bad infection. There was a person that I think they talked about having, I want to say it was like mono or something. It was one of the high school kids that I just read about yesterday. But then when the person who's predisposed to having celiac then ingests gluten, then they suddenly have this reaction. It's like, wait, they didn't have that before. What's going on? And it has to do with just kind of this perfect storm that is essentially happening in that person's body. For me, I know that it was years and years of dealing with allergies that turned into sinus infections, that turned into issues with antibiotics. And basically, like, my gut flora was just shot. I actually developed an allergic reaction to 2 different types of antibiotics. Which to have a reaction to an antibiotic is usually because you've been exposed to it repeatedly before that starts to happen. So I definitely had a weakened immune system, and I had a lot of this going on throughout my adult years, throughout my 20s. I didn't plan on getting into my story, but I guess I kind of am. So getting, I guess, a little bit into my story here. I knew in my 20s that it was not normal to eat as light as I was eating, and I didn't have the best eating habits, but I would still be rather bloated, and I had dealt with just chronic constipation. Most people with typical celiac, they have diarrhea. They have a very close relationship with the bathroom. I would go twice a week. It was not comfortable. I was miserable. I wanted to be able to go more and go regularly, but I had no clue. I had just learned to accept that as my normal. So when I was diagnosed 10 years ago, so 33, what was it? I guess, yeah, 33 years old. That is when I figured out that I had the chronic constipation, the chronic sinus infections. There was a reason, or there was a trigger for that. So I was grateful to have an answer. I was grateful to be able to get those symptoms resolved and to rarely have sinus infections now. Thank God, because I figured out what it was. It was messing with my immune system, with my autoimmune system. And that was definitely a good thing for me. But allergies and autoimmune responses, totally different, or autoimmune disorders, completely different issues. They might initially present with some symptoms that are similar, but what's going on in the body is completely different. Yes, they're both releasing immunoglobulin, which causes the body to attack, but it has a completely different reaction. In the food allergy, they could very quickly escalate to having the anaphylactic reaction and die. The person with an autoimmune disorder, with celiac, there are just different, what happens is your autoimmune system gets completely just wrecked over the years, and it puts us at more risk for other autoimmune disorders, for other things such as cancers, just lupus. There's the lupus is kind of one of those, I guess, oh, I love it when I have a brain fart. That would be one of those issues that it's like, it's not completely cited in literature, but definitely I've seen and heard a lot of that. So that's more of a word of mouth type of thing. And I know that I'm just having a brain fart, so I can't think of the proper words. So anyway, but the celiac, it's damage in the small intestine that happens over time, puts us at more risk for other disorders, and for other issues, but they're not necessarily immediate. The other thing is we could have an immediate reaction and feel it, or it could be hours later when we have that reaction. And then the disadvantage to having it hours later is trying to play the detective and figure out where it happened. So I hope that helps. That's probably a little bit more information, but sometimes it's just hard as the categories are kind of interwoven here, and I want to be able to try to bring you guys the best value. So thank you guys so much for tuning in. If this is helpful, please share it, pass it along to others. If there are other categories within celiac that you want me to cover, please post in the comments below. And thank you guys so much. And I'm going to see if I can turn this off. All right, we're going to hit that button.